The upper limbs.
Position.
Just look at the patient, right?
Look.
Neurological patient. Look at the patient. That might give you clues, right? Maybe there is NGT. There might be tracheostomy, right? So, there is catheter. Maybe there is walking aid, or there is a wheelchair. There is a catheter. So these are the special shoes with the patient. This gives you a clue that what this patient might have. If he has NGT, tracheostomy, so means that this patient has a large stroke, right? Or traumatic brain injury. That's why his consciousness was not enough to feed himself, right? Or to maintain his breathing. These are giving you clue. Alright? Then after this journal, you spend 30 seconds and you listen to the examiner very carefully, right? So in upper limbs, what commands might be given to you? Examine targeted examination, right? According to the target. So the command of the examiner. So the examiner might tell you.
Examine sensor, examine motor.
This patient had severe
Consciousness.
Examiner might tell you examine the upper limbs neurologically, right?
upper limbs.
Neurologically. So it means the problem is in the upper limbs, right? Or if the examiner tells you examine the upper limbs of this patient neurologically and do the relevant. So there is a clue in this command.
Could be lower.
Could be face involvement, could be the lower limb involvement also, right? This might be a stroke on one side. Or he might have weakness of the upper limbs, flaccid, right? The lower motor neuron type and the upper motor neuron type, spastic lower limb, cervical cord problem, right? These are different clues which you should listen carefully while the examiner is asking you to examine, right? Or rarely you might be asked only to examine the sensory system of this patient, right? Then they will not only ask you to examine the upper limb, they will just tell you examine the sensory system. Or examine the motor system of this patient, right? So then you think of some scenario. Motor system examination, Parkinson disease. Sensory system, if they tell you you examine this patient, then you should think of neuropathy or the posterior cord involvement, right? These scenarios, then you should keep in your mind, like Saccharis, Davis Darcel, which is not common. I have not seen in the patient here. Right? So, or vitamin B12 deficiency, subacute combined degeneration of the cord, but you have weakness also, which is spastic side. But initial phase is only posterior column is affected. Posterior column. We will discuss those in the sensory system examination, right? So, if your command in this patient is to examine the upper limbs of this patient and do the relevant, right? So you have got a clue in your brain, right? What clue is there?
There is a home with the other part.
You should be smart, all of you. This should be, and you should leave 2 minutes, at least 2 to 3 minutes for examining the lower limbs. Right? More time you will allocate to the upper limbs because you have maybe 8 minutes or maybe 10 minutes. Right? Usually 8 minutes are given in international standards examination, right? 8 minutes. Right, so now you have got in your mind that this scenario is that there is something else with the upper limbs. Okay? So in upper limbs now, what you are going to examine? Inspection, very important. What inspection is very important in neurology?
Position.
Step by step, right?
Muscle.
Position.
Position. First thing in neurology in the limbs is position. In upper and lower limb both, the first thing is position. So what is the clue in position in the upper limbs?
Decoccate pattern of the
Right?
center.
So okay, what is this?
Decoccate posture.
What is this? Hemiplesic posture, right? This circumduction. This is extended, right? Extensors are stronger in the lower limb and flexors in the upper limb. So in a stroke patient, and hemiplegia, they are doing like this, right? The upper limb is like this, everything is flexed. Internally rotated, flex, 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 flexed. Right? The upper limb. So this might be a clue. In the upper limb, he will be keeping his upper limb like this, right? From the start, you can judge it. Just clues, right? Clear? This should be a cage, if it is there. And the patient, you will look at him, he will be moving the other side easily and this one easily. If this is not a old problem and not a severe problem, right, then you might not have this. Clear? Because if he is plegic, if he is peritic, then you might not see this, right? Then you won't be able to keep it like this. Then the other thing is, after the position,
The bulk of the
face
muscle.
you will generally look at the patient, right? That part you will cover in this NGT, right? A tracheostomy, facial, if he has, right? Clear facial, you can observe that. But you will see that later on in the relevant, because the command is now the upper limbs. That is for the relevant.
Muscle wasting.
Step by step, right? Okay, if there is any abnormal movement, right? Dystonia or something that is visible, you will have during the position, you will have a look at that. If you got the position abnormal like this, right? You try to correct it. And if it goes back to that position, then it is abnormal, right? Otherwise, sometimes patient might be keeping like this, and you will think that this is a stroke, right? So you try to correct, and if it goes back to that, then it means this is pathology. And similarly in the lower limb, right? Maybe patient is keeping like this, and you think that this is external rotation, so you correct, and then you see if it is going back to that position, then it's actual pathological abnormality. Alright, after this position, in the limbs examination, you will see the trick, right? This is very, very important. Very mild abnormality you can pick, which by examining the strength, other things, you spend 1 hour, you might not get it, if this is a mild problem, right? But this drift checking in a stroke patient, it is the most easiest thing and most crucial. You ask the patient to raise both upper limb like this, cervical, and neurology is so easy, even if the patient cannot understand, right? Okay, leave it. If he cannot communicate with you, right? Still you act in front of the patient, right? My grandmother was sick, I was a medical student, and she was having dysphagia, neurological problem. So one of the American neurologists, he came to our area, and I took my grandmother to discuss with him that what's going on. So really, when he started examining her, I was thinking I will translate, and he just acted out and he checked all the examination without talking to her. So you act out in front of the patient, and the patient will follow you. Very little communication is then needed, instructions are needed, and you should give very clear instruction, right? If you ask the patient, he is conscious oriented, you ask him to do like this, he will do like this. Right? Or further, if he is talking and you have the language, then it is added advantage. Sorry, किधर से दुआ शब्द किधर गम मत 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right? He has no problem. No stroke, no weakness, right? If the patient, you ask him to do like this, right? And suppose he has weakness, which is mild. Right? You might have only this. This is called pronation. From supination you got pronation. And then it drifts. If it is more weak, then it drifts. So you got many clues in this, right? Yes.
Why you asking for visualize?
Yes, because you want to distract him to assess more clearly. Because the patient might get clues and he might get adjustment, right? He will bring the other one also like this with this. You want to adjust. These are the visual cues, which the patient mild abnormality he can hide from you, because this is the new human nature. Nobody wants to expose his weaknesses, right? So that you would remove the visual input, that you can see that he's having this pronation and drifting, right? So this is very easy and very important. It gives you many information. Few seconds, right? 10 seconds, 15-second test. What information you get from it? You will ask first our volunteer. What information you can get from this?
Controls.
All right.
Orientation.
Very good. Comprehending, right? That the patient is comprehending. All right.
Weakness.
Motor system.
Weakness.
Cerebellar lesion.
Motor.
Weakness. First of all, we are checking this is motor, right? Motor system. So you have checked that the patient can raise his upper limb. So how much is the power?
At least three.
At least three.
Yes.
At least three. Right? Then further we will check that this is 4 or 5, but now we know that this is at least 3. If we counted 10 and he develops some drift, some pronation and then drifting, right? Now we know from this that
His weakness.
he is having
Immediately.
a stroke, a pyramidal weakness, right?
Yes.
And this is 3. This is not 4. How many informations you got?
I don't understand. 3.
You see, 3 is against the gravity, right?
Okay.
This is 3. If somebody is grade 3 power, he will do this. If he doesn't have grade 3, you ask him R5, he will raise this, he cannot this. Right? Because 2 is from side to side,
Elimination
right?
of gravity.
Yes. Elimination of gravity, right? Without elimination of gravity. Alright? So this is 2. And only
Flicker
Which
of
is
contraction.
flicker, this is 1. Nothing at all, 0.
Zero.
Right? So by this we know that this is 3. But when he drifted, so now we know that this is not 4. This is not 4, not 5. Right? He went down. This is 3. Because he raised it.
Yes.
So by this simple test, you can know his comprehension.
Muscle strength.
You can know his stroke or pyramidal involvement, right? And you can know the grade of weakness. Clear? So this checking the drift is very, very important, right? And very easy. Is there any difficulty? All right. Now, after this, this is examination routine. We go by this technique, right? Ideally, if I was asked to make examination steps, I will make steps of first checking the power and then going for tone and these things. But this is from the start made like that. Really, for me, I'm thinking on this that they should change it. Why? You have checked the drift, right? So you should know now exactly the grade of weakness, and then you go for this is upper motor or lower motor. But this is from the start like this. They bring this one step of checking the upper motor or lower motor in between. Right? So before going to checking the power, you check the tone. These are called royal, royal methods made by someone, and they are carried like this, right? So for checking the tone, the easiest way is to shake hand with the patient, right? And tell the patient, each step there are important instructions, right? Because this is passive. I am the one doing movements for him. He should not. If he is doing movement, then we cannot check his tone. So you will instruct clearly the patient. أنت لا تحرك يدك، أنا أحرك. ريح نفسك. So you are going to assess 1, 2, 3 major joints. Some people come and they waste time on these things, right? What are you looking for in finger? If this is only cortical stroke, right? Once only hand is involved, okay, then you can check this, right? Maybe only the fingers are spastic. But this is very rare scenario where you have a small stroke in the cortex, only the hand is weak. Right, so the tone 1, 2, 3 major joints. And by doing this, I know the tone 5 seconds. Right? Move the this one. You can do like this as well. And if you want to do more, hold familiar and do like. Right? So if this is your initial gut feeling, if you started moving, you came to know there is increased resistance, right? Again you instruct the patient. ريح أنت لا تحرك أنا أحرك يدك. Please relax, do not move, I will move your limb, right? So if you feel there is increased tone, right? After explaining again, then you check if this is rigid or this is spastic, right? So if it is spastic, then you move it with the speed. At the end of the movement, you will have a cage. When I take you to the end, you increase. Not from the start. No, you are increasing from the start. Right, like this. Right? So at the end, there is a cage. There is clasp slide or catch, spastic cage. It's okay from the start, or less increase. But when you do it suddenly with the speed and direction, this is velocity dependent, then you have this increased tone, this is catch. Right? Either in this direction or in this direction.
It's normal.
This also, right? If this is a rigidity, so usually there are 2 types of rigidity. Either this is lead pipe from the start, this is like a pipe of lead, steel pipe, you cannot move it, right? From the start. Or there is cog wheeling, right? Rigidity, increased tone, decreased tone, increased tone, decreased tone. So step by step like that, right? Increase, decrease, right? Step by step. Cog wheel. This was an old area when there were no tires, nothing like this. So they made these wheels of wood for the bull cart and these carts, their wheel. So they were called cog wheels, step by step. They were like this, right? So one coming, then another coming like this. So similarly, that is cog wheel. And in the hand and the rest you can see like this, right? Cog wheel. In pronation, supination also. You can check this. Clear? Right? And if you have decreased tone, if you move this, it will be very supple, right? You can assess the tone. This is your personal impression. Take my advice. Do not utter. Do not make this habit of commentary. Right? Some people, they are very fond of commentary, commenting on this, oh, this is. increase or decrease, because some cases you are not sure. So do not utter this, complete your picture and then you tell. You might adjust, right? The tone was not looking like increase, but when you do the reflexive, they were exaggerated, right? And there was upgoing plantar. Lower limbals were exaggerated. Now you fit the scenario, right? That you should not say this decreased tone because it's not fitting. Even it was nus, you should not say. In exam, it's not nice that you say that I don't, this is up or down. Don't show your dilemma.
Okay.
Hide it and fit it, and then you present. Presentation is also an art, right? Okay, so after the tone,
And then muscle strength.
okay, you have, if you don't, if ladies do not insist that I must expose, right? Ideally, you should have exposure. Now at school, I am not bothering you. Exposure up to the shoulders, right? Particularly if you think that this is a nerve problem or motor neuron disease where you have fasciculation or wasting, right? Otherwise, you can assess the bulk, right? For his age, right? You can assess the bulk and the tenderness if there is myositis. If you found that this bulk is reduced compared to the other side, then you might on one side and compared to the other side. But usually you do not have much time in these scenarios, right? So no need to do those tests. If you see asymmetry, then you ask the examiner. You should have a tape. I want to measure, he will stop you, he will tell you no need. And if you are looking for fasciculations, you show the examiner that you are searching, right? And then you elicit by taping the muscle. Right? Don't just do like this. You tape it. Give it a quick tap. Right? All right. So after this,
Strength.
Okay.
all right. So how you check the power?
By hand.
Resistance.
Resistance.
One by one. Okay, please come.
Okay.
Strength, yes, power.
By hand. Okay.
Not from the up. Start from the only sensation starts from lower. Otherwise from up. So I told you act in front of patient, right?
Mm.
First you see these are active movements. You do not touch the patient. Please come here. Do not touch the patient, right? And act in front of the patient and tell him to do some actions, right? And then you will counter. You will overcome. Be with us. I'm giving you tips. This is your show. So act to the patient, right? First of all, we are checking shoulders. Act.
This is for power?
No. So we get act,
So-
act for him. Up, like this. Like this. So we get okay. So what you know now that how much is the power?
At least.
At least 3. Yes.
How many?
Kawami. Yes, this should be this very good. Kawami. Subit. Now you press full force. Your full force.
6.
Full force. You cannot bring it down. Okay. So this is
6.
no this
Five.
five. Okay, now you do for me. No, first act. First ask me, give me instructions. Okay. No, you did not ask me to resist. Check like this.
Yes, one side is
One side.
Okay.
One side is 6 and the other side is 4.
No 6, no 6, no 6.
Five.
Four.
5 or 5?
My 5?
5, yes. 5 is the maximum, right? The normal is 5. So
6 is 7.
come.
5, 5, 4.
Which one is 5?
3.
4, 5.
4, 5, okay. Then what you check?
Okay. This for the power.
Yes. So complete. This is upper limbs power. Check on him, please. Complete it.
Power.
Power. We are still in power. We have only but this muscle.
خلاص الشولدر.
Abductors. Only abductors. This is abductors. We check the abductors. Alright. Alright. So adductors now. Right? These are adductors. Right? Abductors, adductors. No, already you checked abductors. Now adductors.
No,
العكس.
Right? Adductors. Like this, right? Adductors. Now you can check adductors. The easiest way is like this. Like this, right? نزل تحت لا تخلي انا اوقف نزل تحت نعم. Clear fire. Alright. What else? Now you check the shoulders, right? Adductors, abductors, and adductors, right? Okay. Then what? What else?
Hands.
Three major joints, right? Okay, we'll give
You
chance.
do it like this.
Okay. Please.
What?
Here check shoulders. Now after shoulder, what is cow me, eh? Tell him to come and overcome. Then you are supporting him. Yeah, right.
Eliminate the shoulder movement.
Right? Yes. Overcome, right? Don't let him to apply force from here. Like this, right?
Just a second.
Okay. Can you please fold your arm, okay, towards your side. أسحب عليك. لا تخلي عليك. Now you try to overcome, right? First ask him to do action, then you overcome. I cannot overcome from here, right? And counter from there. Okay, the other side. Flexors of the elbow. Okay. Now extensors.
This is flexion of extension.
Okay. Ask him. Madde. Give him commands. You are not giving him instructions. The instructions must be there. Okay. Extensors of the elbows. مد يدك مد يدك لا تخلي يدك قاوم لا تخلي أنا أسكر. Okay. All right.
Okay, everybody, this turn. Also flex the hand, come it out like this. Don't let me extend it, okay?
Counter, please. Yes, counter. So first of all, we do extension. Take the extension, then flexion. It is just a traditional method.
Okay.
Counter finally.
And then extension, then let me, and then the opposite side. Okay, no, flex it, and let me extend it.
Comparison, right? Always comparable.
Opposite. Flex it, then let me extend it.
Okay. Now the what else after this?
Fingers.
Hands.
Fingers abduction, adduction, and extension. Okay.
So what is the important thing? Figure the easiest test, right? Which gives you yes, very good. Grip, which gives you more information. This one there.
Don't let me, yes. Go.
Cross. Yes.
And then try to pull my,
Like this. Yes.
and hold it. And then try to pull them up.
Pull it. Okay. Okay. Okay.
I hold them.
Yes. Good.
This one is
Alright.
both.
Right? Like this. You are assessing this, that there is weakness. No need to go into further details. If you have neuropathy, right? Neuropathic lesions, radiculopathy, then you go for the further extensors of the fingers, flexors of the fingers, right? Making O, right? Doing these tests, Spencer's, then adductors, dorsal and trachea, they abduct, dab, and this one adduction, right? Then you give a card to hold like this, and you hold from one side, right? And for ulnar neuropathy, the most sensitive test is to ask them to hold the card like, can you hold like this for me with that?
Both?
Yes, and then you, if the patient is having ulnar neuropathy,
No
this
good.
will get flexed, right?
Yeah.
This is the easiest test, foment test, right? This one is easy
What
to pick.
happens?
This thumb
Become like that?
will get flexed, right? Cannot keep it straight and pull it, right?
After you pull the card, it becomes
Yes,
flexed.
yes, it
Okay.
becomes flexed like this on this side.
Oh,
right?
okay.
And if this is a median nerve, particularly the anterosseous branch, then they cannot make, or if they can make it easily, you can break it, right?
Hmm.
You will check with your, please make it. This is his left hand, right? So you will do with the left, right? And right you will do with the right. And this is for both median and ulnar, combined function, right? Only median, another test.
Then touching? Or
Yes. So you will ask him to cock up towards the ceiling. Perfect. لما سهلة. listen. خلي ري. لما سهلة. Okay. ممتاز. لمس. وثبت. حاول. Give him a target to touch. Right? Loaf. For median nerve. What is loaf? All other small muscles of the hand are supplied by ulnar. Right? Except loaf.
Yeah.
Except loaf, which is by median. So usually you have these muscles here. This is called
Thinner.
eminence, right? What we have here?
Flexor pollicis.
Abductor
Flexor
pollicis.
pollicis.
Abductor.
Abductor pollicis.
Abonus pollicis.
Loaf, lumbricals, first two lumbricals, then,
Abonus.
Upon your
Oh.
okay, which opponents? Flexor
Pollicis.
pollicis opponents, right?
Yeah.
Then,
And then
Flexor.
abductor pollicis brevis,
Hmm.
right?
Flexor
Then
pollicis.
flexor pollicis.
Flexor
Brevis.
pollicis,
Brevis.
opponents pollicis, abductor pollicis,
And flex.
and first two lumbricals, right? This is low by median nerve. So you will have wasting here, and they cannot perform these tests, right? In this test also, this is for abductor pollicis. Yes. Right, for abductor pollicis. This for neuropathy or radiculopathy, right? If you have weakness here, this side, right? This is C6. Sensory on this side, or if you have weakness here, or if you have weakness of this, right? This, then C6 radiculopathy or carpal tunnel syndrome of the median nerve,
Hmm.
right? You can have these are to defend. There you have C7. C7 radiculopathy or ulnar nerve lesions. And the sensory also 1.5 finger by the ulnar nerve and other all by median nerve. Alright. So if you have a stroke, then these are not very important. If you check the grip, and grip is okay, khalas, right? If the grip is weak, this because hand function, finger functions, you have assist by this grip test. If this is a cortical stroke, very small area, only hand involved, right? And the others are okay, so you will have weakness of grip, but the proximal will be okay.
Hmm.
If there is weakness of the grip, should I go for the localized lesion? Which if it's a neuropathy rather than.
Then you will have on the other side as well, right?
Yes.
Or if it is radiculopathy, right? If it is a median nerve lesion or radiculopathy, then you will check for these other tests also, right?
So if the grip is okay, I shouldn't go through this, right?
That is for stroke. If you have neuropathy, then you should go for these tests, right? In the stroke, there is no need for go for these. Do not waste your time in this, right? Because we have already checked there is drifting, there is grip weakness, there is shoulder weakness. So you spend this time on the lower limb or on the face, right? Do not waste your time on this. Depends on your scenario. If you have a stroke patient, no need to examine the finger stones, the finger power, right? You have just checked the grip, that is enough. Okay. Now for reflexes. Okay. Please, you have your hammer? Yeah? You have your hammer? Anybody brought the hammer?
No, I have one.
Okay, you have one. Alright, take this. You can use that one also, but ideally for training you should use this one. Yes. The Americans, they use those hammers, right? But ideally some of the neurological centers in the United States as well and in the UK, all they use this hammer. Alright. Go alright, please. See.
I forgot that. I will remember.
Okay, I'm not going to help you. You stay there.
Okay, number one is from upper to downwards.
Okay.
Starting for the biceps, you put your finger from the bicep tendon like this. Of course, try to relax it.
You forgot that story which I told you in earlier. That was not to forget. I told you a story, actual story, what happened to one of our colleagues.
We have a lot of
About
stories.
reflexes?
About reflexes. Then our professor asked him to examine the reflexes of a young girl admitted in the ward. And there, this was summer, right? And the air conditions were not working. There was electricity cut, load shedding. So what he did, he was having the hammer with him, right? So first of all, he did like this, right? Because he was sweating also first time maybe he got he did like this and he did like this. And when he reached there, the girl jumped out of the bed and she ran away. And then with great difficulty they brought her down. Right? So what mistake he did?
Sure, the
Not explain, right? Did not instruct the patient. So first thing is to tell him, the patient, right? I have right shift reflexes, has a observable look. I will gently tape you with this, like this. It will not hurt you. This is very important, right? To instruct for plantar, for these reflexes, deep tendon reflexes, you have to tell the patient, to reassure them, to relax. They should not be tense, right? And they should not be scared. First, do in front of them. Show them that it's not hurting, right?
Okay. I will start with this gently. It doesn't hurt. Okay. So it doesn't matter starting from up or down.
Relax. Tell him to relax himself. Keep the hammer there. First position. First of all, position.
Of course, try to relax the entire limb.
Okay. So how you will relax? What is the ideal position, right?
For each reflex,
Yes. Ask him. This is midway between pronation and supination, right? Right, like this.
and flexed across the middle.
Like this.
Okay.
This is very easy to ask the patient to do like this, right?
Yes.
So this is midway between pronation and supination, and this is very comfortable. Okay.
Okay. Then I should go for the biceps reflex. I think.
So you palpate the tendon.
الشد هذه؟
Yes.
لا لا اضغط علي اسحب الأمن. That's fine. So my hand on the bicep tendon, tap on my finger, on my knee. And of course I should either inspect on the biceps or I can feel the contraction.
Expecting there.
Yes.
You
So,
got it?
yeah, I either feel it in my hand and
If you do not get, then what you will do?
Reinforcement.
No, before reinforcement.
Reassure, tell them to relax.
It's a reposition and
Mm.
relax the
Mm.
patient, right? Reposition, move it, check that he is not tensing, right? Reposition it properly and reassure the patient and check. If you do not get again, reinforcement, clench the teeth, reinforcement. If you do not get after reinforcement,
Means not there.
yes, so what is the grade of reflex?
Nothing. Yeah.
0,
0.
right? If you get it after clenching teeth, after reinforcement, then it is
1.
1.
I got it.
Yes, and normal is
2.
Brisk. Right? Brisk is 3, and if there is clonus, this is 4. Okay. Go ahead.
okay. The other reflex is the
No, compare. Always compare. Now this one up, right? Bring the other.
no.
Yes.